Hypothyroidism is a condition where the thyroid gland is underactive and it doesn't properly make or release thyroid hormones. The thyroid gland normally releases many crucial hormones, and these travel through the bloodstream to reach receptors throughout the body. So a disturbance in the thyroid function can cause widespread, noticeable health problems. The thyroid is a small gland located at the base of the neck. Sometimes it's described as butterfly-shaped. Meanwhile, at the base of the brain sits the pituitary gland, and this secretes the thyroid stimulating hormone. This makes the thyroid produce and release thyroxine, the main thyroid hormone. Almost 5% of the US population over the age of 12 has some form of hypothyroidism. Some estimates suggest up to 40% of the population suffers from at least some level of an underactive thyroid. Women, especially older women, are the most susceptible group for developing hypothyroidism. People who are elderly, who have other existing autoimmune diseases like type 1 diabetes, rheumatoid arthritis, and celiac disease, for example, are also at a higher risk. Changes to your metabolism, heart function, digestion, energy, appetite, sleep, and mood, even the growth of your hair, skin, and nails can all be affected by hypothyroidism. However, there's many ways to treat the hypothyroidism naturally, through a hypothyroidism diet plan and other remedies. The most common cause of hypothyroidism in developed nations is a condition called Hashimoto's thyroiditis. This is an autoimmune endocrine disorder, and it occurs when the thyroid becomes inflamed. When someone has Hashimoto's, their own body essentially begins to attack itself by producing antibodies, and these try to destroy the thyroid gland. The immune system mistakenly thinks the thyroid cells are not part of the body, so it tries to remove them before they can cause damage and illness. The problem is this causes widespread inflammation, and this can result in many different problems. 90% of people with hypothyroidism have Hashimoto's, and this inflames the thyroid gland over time, but it's not the only cause of hypothyroidism. A diet that's low in nutrient-rich foods, especially iodine and selenium, which are trace minerals that are crucial for thyroid function, increases the risk of hypothyroid disorders. The thyroid gland needs both selenium and iodine to produce adequate levels of the thyroid hormones. These nutrients also play other protective roles in the body. For example, a severe selenium deficiency increases the incidence of thyroiditis because it stops the activity of a very powerful antioxidant known as glutathione. This normally controls inflammation and fights oxidative stress. Getting on track with hypothyroidism ensures you get the appropriate amounts of selenium and iodine in your diet. In some rare cases, because the pituitary gland makes a hormone called thyroid stimulating hormone, and this controls the levels of hormones being pumped out of the thyroid, a problem with the pituitary gland can cause changes in thyroid function. An unhealthy gut environment can contribute to nutrient deficiencies and can raise autoimmune activity in the body. Food sensitivities or allergies, including those to gluten and dairy, can trigger gut inflammation. Other causes of a damaged gut are high stress levels, toxin overload from the diet, and environmental and bacterial imbalances. When a leaky gut occurs, small particles that are normally trapped inside the gut start to leak into the bloodstream through the tiny openings in the gut lining. This creates an autoimmune cascade and a series of negative symptoms. Although it's not very common, newborns are sometimes born with dysfunction of the thyroid gland, a genetic condition called congenital hypothyroidism. During or following pregnancy, although it's not exactly known why, some women begin to produce high levels of thyroid hormones, followed by a very rapid decline. This condition is known as postpartum thyroiditis. The symptoms often disappear within 12 to 18 months, but they can also lead to permanent hypothyroidism. It's known that women pass on their iodine stores to their children, and the first child gets the highest amount of iodine, and as a result, the first child tends to have better mathematical cognitive abilities. Specific medications can lead to developing an underactive thyroid. The most common ones include drugs to treat cancer, heart problems, and certain psychiatric conditions. Stress impacts hormones and is known to worsen inflammation. Stress can raise the level of cortisol and adrenaline, and this disturbs neurotransmitter function, and it worsens the symptoms of thyroid disease. These include low energy, poor mood, low concentration, disturbed appetite, weight gain, and the inability to get a restful sleep. Exercise and diet are important for controlling the chronic stress and managing hormone-related neurological function. Research shows people who regularly exercise usually get better sleep, they deal with stress better, and more often maintain a healthier weight, all of which reduce some of the biggest risk factors and symptoms associated with hypothyroidism. The thyroid is considered a master gland. In addition to producing the crucial hormones, it also helps control the process of turning nutrients from food into usable energy. Because the thyroid plays such a major part in your metabolism, a dysfunction can affect almost every part of your body, including your energy levels and your ability to burn calories. Key hormones produced by the thyroid also help the liver to break down cholesterol. The thyroid can also stimulate enzymes that are needed to control triglyceride fat levels. This is why changes in the thyroid function can lead to heart problems. Other noticeable effects of hypothyroidism include moodiness and a sluggish metabolism. Essentially, when your thyroid is underactive, your metabolism will slow down, and this means you can always feel tired or struggle to keep the weight off. Your mood is especially susceptible to changes in hormone levels. So some people with hypothyroidism deal with depression, anxiety, trouble getting to sleep, and low immunity. The thyroid gland helps to regulate chemical messengers called neurotransmitters, and this controls your emotions and nerve signaling. This is the reason an out of balance thyroid can mean a drastic emotional change at times. Some of the most common warning signs of hypothyroidism include fatigue, depression, anxiety, weight gain, and infertility. Goiter, which is nodules at the base of the neck, sometimes accompanied by a tightness in the throat, coughing, or swelling. Feeling cold, constipation, muscle aches and tenderness, and kidney problems. Stiffness and swelling in the joints, hair loss, rough, cracked skin, trouble breathing, changes in the menstrual cycle, more frequent cold or flu due to low immune function. To test if you've hypothyroidism, your doctor can run blood tests and check the levels of hormones known as T4, thyroxine, and TSH, thyroid stimulating hormone. Hypothyroidism is diagnosed in your thyroid when the TSH is high. Sometimes TSH can be high, but the thyroid is still producing enough hormones. This condition is referred to as subclinical or mild hypothyroidism. Mild hypothyroidism is usually the early stage. It can progress to hypothyroidism if a hypothyroidism diet isn't adopted and lifestyle changes aren't made. When the condition isn't corrected, more severe autoimmune reactions can occur. This can cause worse problems like impaired brain function, infertility, unhealthy pregnancy, obesity, heart complications, and joint pain. Other symptoms to be aware of are thyroid nodules, a buildup of cells within the thyroid, creating an abnormal lump. Most thyroid nodules aren't dangerous, but some of them can become cancer over time. If your physician suspects you have thyroid nodules, he or she should have them evaluated to check for cancer cells. For a patient with thyroid cancer, a common conventional treatment method is known as radioiodine or radioactive iodine. In some cases, people with an extremely underactive thyroid might fall into what's known as myxedema coma. This is characterized by declining mental status, hypothermia, and the slowing of many internal organs. If you or someone you know has a severe thyroid problem and begins to show major lethargy or stupor, you should seek emergency medical attention. Myxedema comas are rare, and they occur most often in the elderly and women, especially in the winter months. Generally, it's the result of an undiagnosed or untreated hypothyroidism and can be fatal if left untreated. Hypothyroidism is very prevalent in kidney disease patients. In a current opinion in endocrinology, diabetes and obesity study, evidence suggested that hypothyroidism was a risk factor for chronic kidney disease. Chronic kidney disease progression and even higher death rate in kidney disease. When you're on a hypothyroidism diet, you want to eat wild-caught fish. This provides omega-3 fatty acids EPA and DHA, and these are essential for hormone balance and thyroid function. Coconut oil provides medium-chain fatty acids in the form of caprylic acid, lauric acid, and capric acid, and these support a healthy metabolism, increase energy, and fight fatigue. Seaweed is one of the best natural sources of iodine, and this can help prevent deficiencies that disturb the thyroid function. Probiotic-rich foods, these include kefir, organic goat's milk, yogurt, kimchi, kombucha, natto, sauerkraut, and other fermented veg. Sprouted seeds like flax, hemp, and chia seed provide alpha-lipoic acid, a type of omega-3 fat that's critical for the proper hormone function and the thyroid function. Clean water, as water helps with hydration and digestive function while preventing fatigue and moodiness. For prevention of constipation, low energy, and sugar cravings, drink at least 8 ounces every 2 hours. High fiber foods. People with hypothyroidism may have digestive difficulties, so aim for 30 to 40 grams of fiber per day. Not only does a high fiber diet help with digestive health, it also improves heart health, balances blood sugar levels, and supports a healthier weight by making you feel fuller. Bone broth, such as beef and chicken stock, contains the amino acids L-proline and L-glycine, and these help to repair the digestive lining and improve hypothyroidism. Fruits and vegetables are high in vitamins, minerals, and antioxidants. These are necessary for combating the free radical damage and lowering the inflammation. They're nutrient dense, and they should make up a large portion of a healthy diet, since they support digestive health, brain function, heart health, hormone balance, and a healthy weight. Foods you should avoid are goitrogen foods. People with hypothyroidism want to stay away from eating large amounts of raw brassicas, like broccoli, cauliflower, cabbage, kale, soy, and Brussels sprouts. These vegetables can impact the thyroid function because they contain goitrogens. These are molecules which impair thyroid peroxidase. Avoid tap water as it contains fluoride, an endocrine disruptor, and chlorine that inhibits the iodine absorption. Gluten. Many people with thyroid issues are also sensitive to gluten, or they have celiac disease, an autoimmune disease that can result in an allergy to gluten. Gluten is found in all wheat, rye, and barley products. Carefully check ingredient labels and avoid hidden gluten that's lurking in many packaged foods. Conventional dairy, like gluten, can be especially problematic for the thyroid. It can trigger reactions that raise inflammatory responses. Avoid conventional cow's milk, products that are not organic, and products that have been pasteurized. Consumption of organic raw goat's milk tends to be a better choice. Sugar can disrupt the hormone balance necessary for your metabolism. People with thyroid issues have a difficult time losing weight because the thyroid is a key gland for hormone balance and metabolism. It's best to avoid sugar as it can contribute to hormonal disturbances, fatigue, mood changes, worsened depression, and weight gain. Refined flour products also can disrupt your blood sugar. Ashwaghanda is an adaptogenic herb. It helps the body respond to stress, to keep your hormone levels better in balance. Adaptogens help to lower cortisol and to balance the T4 levels. In fact, in clinical trials, supplementing with ashwagandha for 8 weeks essentially worked as a thyroxine treatment, helping hypothyroidism patients significantly increase their thyroxine hormone levels and thus reduce the severity of their disorder. Also try other adaptogenic herbs like Rhodiola rosea, licorice root, ginseng and holy basil, as these have similar benefits. Studies show that even small amounts of supplementary iodine, 250 micrograms, cause slight but significant changes in thyroid hormone function in predisposed individuals. A diet rich in whole foods that contain iodine, including fish, sea vegetables, eggs, raw dairy and seaweed, can help prevent a deficiency. The controversy starts as many people think people who have Hashimoto's should not get too much iodine, as this can increase the risk of developing an overactive thyroid. While it's nearly impossible to get too much from eating a variety of health foods alone, sometimes people take supplements or eat very high amounts of dried algae or seaweed to increase the recommended upper limit of their iodine intake to 500 milligrams per day. Although in Europe and America the recommended dose of iodine is 150 to 300 micrograms per day, according to Dietary Reference Intake 2015 for Japan, the tolerable upper intake level is set at 3,000 micrograms per day. This is much higher than that of other countries. When it comes to Hashimoto's being an autoimmune disease that can attack the thyroid, in order to supplement with iodine, one first needs to remove the autoimmune condition by adopting the autoimmune diet and then using blood tests to check how your autoimmune is responding, such as C-reactive blood protein, the CRP test, the ESR, erythrocyte sedimentation rate, and the ANA, anti-nuclear antibody blood tests. You can determine if your autoimmune condition has improved. Then you can correct any selenium deficiency. You can supplement with NAC and glutathione. Once all these are done, then you can slowly introduce nascent iodine. As nascent iodine has a short effect on the body and only lasts for around 3 hours, it's usually taken as 1 drop at breakfast, lunch and dinner. This can then be increased throughout the day depending on how your blood markers test. The thyroid is the organ with the highest selenium content in the body. Selenium is necessary for the production of the T3 thyroid hormone, and it can reduce autoimmune effects. In patients with Hashimoto's disease and in pregnant women with thyroid disturbances, selenium supplementation decreased antithyroid antibodies, and it improves the structure of the thyroid gland. Because it helps to balance hormone levels, selenium can lower the risk of experiencing thyroid disorders during pregnancy, such as postpartum thyroiditis. Other studies have shown when selenium deficiency is resolved through supplementation, patients experience on average a 40% reduction in their thyroid antibodies compared to a 10% increase when given a placebo. L-Tyrosine is an amino acid used in the synthesis of thyroid hormones, thyroxine T4, and it's naturally produced from an iodination of tyrosine, a non-essential amino acid obtained both from protein containing dietary sources and through the body making it itself. Supplementing with L-Tyrosine has been shown to improve sleep deprivation and can help to combat fatigue and a poor mood by improving alertness and neurotransmitter function. One reason L-Tyrosine is beneficial for healing the thyroid symptoms is because it plays a role in the production of melatonin, dopamine, and norepinephrine. These are our natural feel-good hormones. The L-Tyrosine is taken in the day, as like caffeine, it can improve energy and mood, but too high a dose can make one feel restless. Essentially, fatty acids found in fish oil are critical for brain and thyroid function. DHA and EPA omega-3 oils found in fish are associated with a lower risk of thyroid symptoms, including anti-anxiety, depression, high cholesterol, inflammatory bowel disease, arthritis, diabetes, a weakened immune system, and heightened autoimmune disease. The omega-3 oils can also help to balance the levels of omega-6s in the diet, and this is important for ongoing health as it brings down inflammation. B12 and thiamine are important for neurological function and hormonal balance. Research shows supplementing with thiamine can help to combat symptoms of autoimmune disease, including chronic fatigue. In one clinical study, when patients with Hashimoto's were given 600 mg per day of thiamine, the majority experienced a complete regression of fatigue within a few hours or days. B12 is another important nutrient for fighting fatigue because it benefits the central nervous system in many important ways. It maintains the health of the nerve cells, including the neurotransmitters. It protects the covering of the nerves, called the cell's myelin sheet, and it turns nutrients from food into usable energy for the brain and the body. Probiotics can help to heal the gut and aid in nutrient absorption while reducing inflammation. Other benefits of high-quality probiotics include helping to maintain a strong immune system, increasing energy from the production of B12, reducing bacterial or viral growth in the gut, such as candida, improving skin health, and helping with appetite control and weight loss. To improve thyroid function and help treat the symptoms of autoimmune disease, you can try some essential oils. You can combine 3 drops of frankincense oil with 5 parts lemongrass and 5 parts clove oil. Rub them directly onto the thyroid in a carrier oil. This is located at the front lower part of the neck. You can also try putting 2 drops of frankincense oil on the roof of your mouth twice daily. Similarly, you can try rubbing 2 to 4 drops of lemongrass oil and myrrh in a carrier oil directly on the thyroid area. To combat muscle or joint pain, you can try a bath using geranium, clove, myrrh, and lemongrass oil. To fight fatigue, you can try a combination of peppermint and citrus oil, such as lemon and grapefruit. To improve your mood and reduce anxiety or irritability, you can use chamomile, frankincense, and lavender oil. In patients with subclinical hypothyroidism, lipoic acid improved the endothelial function by decreasing oxygen-derived free radicals. Iris versicolor, or blue flag, is an important medicine among the American tribes. It's considered to be a strong medicine, and it's used for swellings, bruises, burns, sores, inflammation, and blood poisoning. Internally, it was used to treat colds, sore throats, lung troubles. It's also been used to treat hypothyroidism. In Ayurvedic traditional medicine, Forskholin is used for supporting the healthy function of the heart and the lungs, and for treating some severe ailments such as hypertension, spasmodic pain, kidney stones, painful urination, convulsions, obesity, painful menstrual periods, irritable bowel syndrome, advanced cancer, blood clots, sexual problems in men, and insomnia. It's known to raise the thyroid levels in cases of hypothyroidism. It stimulates metabolism by increasing thyroid hormones and increasing the secretion of insulin. It also increases energy, weight loss, and when taken with artichoke, it increases brain power and memory. In an older study from 2008, people who received 3 grams of ginger powder each day saw a significant reduction in their cholesterol markers. Their LDL, or bad cholesterol levels, dropped by 10% over 45 days. These findings are supported by a rat study with hypothyroidism and diabetes. Ginger is known to have antioxidative properties, along with control on the metabolic rate and inflammation, and this helps keep the thyroid hormones in control. Leaky gut can contribute to issues like Hashimoto's disease, along with arthritis, skin issues like psoriasis, and other health concerns. Because glutamine is a major fuel source for the cells of the small intestines, it's been shown to support intestinal health and treat leaky gut in clinical cases. Typical doses are 5 grams twice a day. Lemon balm may have anti-thyrotropic effect, so if you have hypothyroid or you're on thyroid medication, you want to avoid using lemon balm. In the 19th century, the powdered nettle seed was considered a cure for goiter, and efficacious in reducing excessive corpulency or hypothyroidism. There's also many other adaptogenic benefits to having nettle seed, such as reducing stress, improving mood, increasing energy, improving cognitive function and motivation, and it's also packed with beneficial nutrients. You can check out my video on nettle seed for more information. Taurine alleviated the perturbations in thyroid function, and it improved thyroid histoarchitecture. The beneficial effects of the taurine can be attributed to its ability to protect the body from toxicity and oxidative stress. It's suggested that low levels of melatonin may be connected to low levels of thyroid hormones, explaining why taking melatonin helps to improve the TSH levels. Valerian can help to reduce sleep disturbances in a variety of conditions like rheumatoid arthritis, menopause, hypothyroidism, PTSD, HIV, fibromyalgia, and benzodiazepine withdrawal. Methylation is involved in cognition, repairing DNA, turning genes on and off, fighting infections and inflammation, and getting rid of toxins. Problems with methylation can contribute to addictions, Alzheimer's, anxiety, ADD and ADHD, bipolar and manic depression, chronic fatigue syndrome, dementia, diabetes, fibromyalgia, schizophrenia, and hypothyroidism. You can check out my videos on methylation, the MTHFR gene polymorphism, and supplementing with B vitamins, D-L-methionine, and activated folate to help to treat the methylation and the toxic effects of the raised homocysteine levels. In lab animals and test tubes, zinc deficiency was associated with a decline in thyroid function. In 134 disabled hypothyroid patients under anticonvulsant therapy, zinc supplementation was able to normalize the thyroid hormone levels in the blood and to restore the thyroid function. A study on 25 children with Down syndrome suggested similar effects from zinc supplementation. Zinc supplementation was also able to reverse the damaging effects of computer monitor emitted radiation on the thyroid hormone levels. You can try something like OptiZinc, as this has copper added, and this helps prevent a copper deficiency, as zinc supplementation lowers your copper levels. Proteolysis or protein digestion is likely to be impaired in hypothyroidism. You can take digestive enzymes with each meal to enhance your digestion. Probiotics can then enhance the nutrient uptake. Low stomach acid is common in hypothyroidism. This can result in depletion of amino acids and key nutrients like zinc, selenium, B12, and iron. These are needed for thyroid support, as well as for the synthesis of non-essential amino acids. It also can result in common Hashimoto's triggers, including food sensitivities, and less resistance to pathogenic invasion. It's estimated 50 to 70% of people with Hashimoto's have a deficiency in stomach acid. You can supplement with betaine hydrochloride, a compound that contains hydrochloric acid. This often relieves the symptoms of heartburn and it improves digestion. Again, a gene variation of the MTHFR, or methylene tetrahydrofolate reductase gene, is commonly found in Hashimoto's, and it results in poor methylation or ability to detoxify. This gene synthesizes the amino acid methionine from the amino acid homocysteine. Methionine is important for the body's ability to detox. Someone with the MTHFR gene variation will have lower levels of methionine and homocysteine, can then build up to toxic levels. This has been associated with inflammation and heart disease. One of the 3 requirements for developing Hashimoto's is having this genetic predisposition. N-acetylcysteine, or NAC, is a sulfur-based derivative of the amino acid L-cysteine. In the body, it acts as a potent antioxidant, and it's been noted to be nearly 100% hepatoprotective. In other words, it has the ability to protect against liver damage. In the 70s, it was found to be an antidote for Tylenol or paracetamol overdoses, and later in the 80s it was discovered that it can prevent toxic reactions to chemotherapy. It can also help prevent and treat viruses and respiratory illnesses, detoxify from heavy metals, support the mood, and prevent the underlying cause of most forms of mental illness, and it also has anti-aging properties. Those with Hashimoto's often have an impaired ability to clear toxins, and they may have an overload or accumulation of toxins. Toxins can accumulate due to intestinal permeability or leaky gut, and this can result in the absorption of problematic substances and lead to impaired detox abilities. Studies have shown everyone with an autoimmune disorder, including Hashimoto's, has some degree of intestinal permeability. Additionally, there's several other factors associated with Hashimoto's that can cause an impairment in the ability of the liver to properly eliminate toxins from the body. These include a decreased ability to sweat and to eliminate toxins through the skin, nutrient absorption issues, food sensitivity that can then lead to accumulated antibodies. N-acetylcysteine is a precursor to the antioxidant glutathione. Glutathione is the most abundant antioxidant in the body, and thus it's sometimes called the master antioxidant. It plays a role in many functions, including antioxidant defenses, nutrient metabolism, and the regulation of cellular events, including gene expression and cell proliferation, and the immune response. Glutathione doubles as a heavyweight protector against oxidative stress, and it can also protect the body against chronic inflammation. A depletion in glutathione levels has been implicated with higher levels of thyroid antibodies, and it may contribute to Hashimoto's. One study conducted in 2012 found that Hashimoto's patients had 62% lower levels of serum glutathione compared to age-matched controls. In the same study, a significant relationship was identified between serum glutathione levels, TPO antibodies, and TSH. The lower the glutathione, the higher the antibodies, and the higher the levels of TSH, suggesting hypothyroidism. As a precursor to glutathione, N-acetylcysteine can help to optimize the glutathione levels and reduce the thyroid antibodies. N-acetylcysteine is an antioxidant in its own right. As a sulfur donor, it helps to scavenge free radicals, and it does double duty helping to boost the glutathione levels by converting into glutathione in the body. If you're healthy, your body should make an adequate supply of glutathione. Unfortunately, many variables overwhelm your body with oxidative stress and chronic inflammation, like stress, infections, and a poor diet, and this can result in your body making less than optimal amounts of this master antioxidant. This is not uncommon in patients with Hashimoto's. Researchers have found that several genes encoding different inflammatory cytokines can influence the severity of Hashimoto's. The N-acetylcysteine can help to dial down the inflammation. In one study, the researchers found the N-acetylcysteine provided anti-inflammatory benefits while increasing the enzyme superoxide dismutase. This fights against the reactive damage of the oxidative molecules. Glutathione and glutathione S-transferase, the latter two enzymes, also act against harmful oxidative molecules. So the researchers concluded the N-acetylcysteine has both anti-inflammatory and anti-ulcerative effects. If you have a thyroid problem, a big part of it is the development of a gut autoimmune disorder, commonly stemming back to a condition called Leaky Gut Syndrome. Hippocrates is famous for saying all disease begins in the gut, and today many scientific studies are telling us that he was right. If you're going to fix the thyroid, you first have to help to fix the leaky gut syndrome. When you have a leaky gut, holes in the lining of your intestine become larger, and particles like gluten can get through the tiny openings where they enter into the bloodstream. This is why a lot of people with thyroid issues, if you go on an anti-inflammatory and gluten-free diet, will notice almost immediate results in terms of better thyroid function and a reduction of symptoms. One of the 3 requirements for developing Hashimoto's is considered to have some degree of leaky gut. While a healthy intestine allows for nutrients to be absorbed and blocks the absorption of pathogens and toxins, a leaky gut cannot. The gut barrier is supposed to keep potentially inflammatory proteins from entering the bloodstream, where they can trigger an immune response, even contributing to autoimmunity. The amino acid glutamine, again, is essential for proper gut barrier integrity and immune function. It's usually depleted in people with Hashimoto's, as well as those experiencing chronic stress. The liver is vital for protein synthesis, protein breakdown and utilization, and detoxification, as well as amino acid metabolism. An abundance of amino acids such as glutamate, glycine, alanine, aspartate, serine, threonine, and histidine are all active in the liver, and their overwhelmed liver can then lead to the buildup of toxins, and this can deplete our amino acids as they're required to help us get rid of toxins. Infections like Helicobacter pylori, which is commonly associated with ulcers, can prevent the absorption of certain amino acids from our food, while other infections can potentially increase our requirement for amino acids. One study found that L-lysine reduced the incidence of recurrent herpes in Brazil. The lysine can be particularly helpful for improving immune function in communities that are deficient in this amino acid. Additional research has shown infections can lead to a decreased protein within the body, but consuming extra protein, 20 to 25% more than the recommended intake, can be a complementary method for treating the infections. You must let your system rest and your gut heal if you want to normalize the immune system and the thyroid gland function. The most important step to controlling Hashimoto's disease is using your diet. If you've Hashimoto's, you should go gluten-free. This might seem tough and overwhelming and like a big challenge, but it's important. It's recommended going gluten-free and overall grain-free for a period of time, a total of at least 3 months, to see how you improve. Gluten is one of the biggest autoimmune and allergen culprits, but it's not the only one. Look for other foods that can act like gluten in the body and contribute to gut inflammation. Dairy products that are pasteurized and homogenized, plus regular unsprouted grains, are 2 of these food groups. In centuries past, dairy foods were eaten raw, and ancient grains were easier to digest, and they provided more absorbable nutrients because they were soaked, sprouted, and fermented. Today this practice has been forgotten, and refined and bleached flours are consumed in higher quantities than ever before. Excess sugar in the diet will undoubtedly cause inflammation of the gut, not to mention contribute to blood sugar fluctuations, weight gain, nervousness, and other symptoms. Fast food and packaged products made with refined oils, like vegetable oils like safflower, sunflower, canola, and corn oil, are all also highly inflammatory and low in nutrients. The best diet to follow if you have hypothyroidism or Hashimoto's is a healing diet that's high in vegetables and fruits, as well as nutrient-packed foods like bone broth and organic meat. These are foods that are easiest for your body to digest and least likely to cause allergic and autoimmune reactions. The ultimate type of diet you should follow is similar to the GAPS diet plan and protocol. This is an ancient diet that's full of fruits, vegetables, organic meat, and it's been found to be effective for many people struggling with inflammatory bowel disease and autoimmune disorders. Eating things like bone broth soup is fantastic, as well as eating probiotic-rich foods like yogurt. Fruit and vegetables are high in antioxidants, vitamins, minerals, and fiber. The fiber helps with digestive health, improves heart health, balances blood sugar levels, and supports a healthy weight. The antioxidants and other nutrients fight inflammation and prevent deficiencies. The second step after diet to help to heal and repair the thyroid is to require specific nutrients and supplements that lower the autoimmune reaction, to help your body handle stress better and regulate the activity of the immune system. These include selenium, probiotics, vitamin D, ashwagandha, and other adaptogenic herbs. Selenium benefits the thyroid because it's been shown to regulate the hormones T3 and T4. Selenium can also lower the risk of thyroiditis during pregnancy and afterwards. A diet that's low in iodine and selenium increases the risk for autoimmune thyroiditis because the thyroid gland needs both the selenium and the iodine to produce the adequate levels of thyroid hormone. Toxicity such as mercury amalgam fillings can deplete your glutathione and selenium levels. 3 Brazil nuts per day can help to provide the required selenium. Probiotics help support gut health and strong immunity by balancing the microflora in the digestive tract. By repairing your digestive lining, inflammation is reduced, and this helps your thyroid as well. Some research has shown more than 90% of patients with thyroid disorders are deficient in vitamin D. The vitamin D helps to regulate your immune system, and it acts in many ways like a hormone. One of the best ways to get enough vitamin D is to spend time outside in the sun each day, with your bare skin exposed. Supplementing with 600 to 5,000 international units per day of vitamin D can also be beneficial. It's best to get a blood test to assess your levels and supplement accordingly. Ashwaghanda is proven to help reduce thyroid and adrenal issues by boosting your body's ability to cope with stress and balance hormones. Medical research shows it helps to balance thyroid hormone T4, and this is critical if you're going to overcome hypothyroidism or Hashimoto's disease. Other adaptogen herbs work in similar ways. B vitamins, especially B12, are important for energy maintenance and many cellular and metabolic functions. Vitamin B12 is known as the energy vitamin, and it supports normal cellular function that fights fatigue. In one clinical study published in the Journal of Alternative and Complementary Medicine, the majority of patients with Hashimoto's who were given 600 milligrams per day of thiamine experienced a complete regression of fatigue within a few hours. Detoxification and cleansing on a regular basis are beneficial for your thyroid gland to help to lower the inflammation. This includes reducing your exposure to hormone disruptors in the environment, chemicals in your home, and heavy metals. If you take birth control pills or medications regularly, consider trying alternative natural approaches to contraception or speaking to your doctor about reducing your medication dose. If you have amalgam fillings in your mouth, look at getting them removed. Pay attention to the type of personal care products and cleaning products you're using at home. Consider replacing the synthetic chemicals with natural products. Store food in glass and ceramic containers instead of plastic and aluminium. Quit smoking, using drugs, and drinking alcohol in excess. According to research regarding stress and autoimmunity, published in the Immunology and Allergy Clinic of North America, stress reduction interventions can have a positive therapeutic effect on autoimmune diseases. Studies have found a high proportion, up to 80% of the patients with autoimmune symptoms report uncommon emotional stress before a disease onset. Stress can trigger alterations in the production of neuroendocrine hormones and can contribute to immune dysfunction by increasing the cytokine production. Doctors are now warning patients that stress management should be considered in all multidimensional treatment approaches to resolving the underlying causes of Hashimoto's disease and other disorders. Different things work for different people when it comes to lowering stress. Taking detox baths with Epsom salts, regularly doing adaptive exercise like yoga, Pilates, and weight training, reading, spiritual growth books, spending time outdoors, and fostering good relationships are all proven natural stress relievers. Food that's not organic can be full of pesticides and Roundup or glyphosate, and this can cause all sorts of autoimmune issues. Therefore, a 100% organic diet, locally sourced, non-irradiated, would be the best option. Often, just changing to a 100% organic diet can solve the majority of negative health symptoms. It's very important not to leave the symptoms of thyroid issues like Hashimoto's disease unchecked and unaddressed. If you suspect you have a problem with your thyroid, you should definitely have testing done as soon as possible. Sometimes second opinions can be helpful to ensure a proper diagnosis. You should also get the thyroid tests repeated a month later to ensure that your levels are actually as bad as they say. For more information on any herb or supplement mentioned in the video, you can check out my website. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.